Hi guys! This is going to be a tutorial on how to do a newborn assessment. So my name's Kat and I'm playing the infant.
My name is Jackie.
And I'm Addie.
And we're the nurses. My name is Carmeli.
My name is Layla.
And we're the parents.
So before we begin, the first thing we would do is prep and undress the infant. Am I allowed to undress your infant?
Mm-hmm.
Okay, or do you want to do it?
Oh, I'll do it.
Okay.
So in pediatrics, we should provide atraumatic care. And in this case, that includes holding the baby in the parent's lap. This can help keep the baby calm, still, and prevent any accidents.
Mrs. Jones, am I allowed to put your infant on your lap?
Yes, ma'am.
Okay.
So as a nurse, if the baby is uncooperative, we can use techniques such as using a softer tone of voice, using a rattler, using a pacifier, or a bottle to distract the infant.
The next thing we're going to do is a full head to toe on the infant. Before listening to the baby's heart, we'll use the same landmarks for auscultation as we would for an older adult and an adult. As a normal infant, heart rate is between 120 to 160 beats per minute, making the cardiac exam a challenge. We may need to listen up to a minute before we can clearly make out the sounds of the systole and dystole.
1 minute later.
So the next part of the physical assessment would be to check the eyes, ears, nose, and the chest circumference. Measure the head circumference in centimeters by wrapping a measuring tape in a circle just above her eyebrows to the most prominent aspect of the occipital. To assess the respirations, we need to keep in mind that it is normal for the infant to take short pauses in their breathing or breathe at a slightly irregular rate. This is called periodic breathing, and sometimes it takes new parents by surprise. So what we would do first is auscultate the apex of the lungs and around the sides and back. The lungs should be equally loud with a clear passage of air and no wheezes or crackles.
A few minutes later.
So for our vital signs, we got 110 for heart rate, 35 for respirations, 98.6 for temperature, 95/58 for our blood pressure, and 42 centimeters for our head circumference.
The next thing we're going to do is auscultate the abdomen, and then we're also going to palpate. And now to end our infant physical assessment, all we're going to do is a Moro reflex.
To elicit the Moro reflex, you have the infant set up midline relaxed, and then you drop them down a few inches. This reflex tests how babies react to stimulation. It may also act as a survival instinct and helps babies regain balance and protect themselves from being dropped or falling.
Okay, so Piaget's cognitive development theory. So sensory motor is birth to 2 years, and it is the coordination of senses and motor responses that is typically characterized by simple reflexes. It's in sensory-based curiosity of the surroundings, and the senses help the child develop an initial understanding of their environment.
Psychosocial development, which is Erickson's. And for our area for infancy, it's trust versus mistrust, and that's from birth to 1 year old. For trust, it dominates in the first year of your life, and it's the first and most important attribute for a healthy personality. And this can be done with loving care of your parents and guardian. And for mistrust, it's when trust promoting experiences are lacking or inconsistent,
But this was how to do a physical assessment on an infant. Thank you.